the technicians who are coming from different countries, from Austria, from Germany, actually from all over the world. And yeah, I'm here today to speak a bit about veneers and yeah.
Joshua will share his experience in veneers because you all know that the doctor is able to prepare the teeth for the veneers, but it's the work of the lab that matters because they are the one who will deliver for us these beautiful Emax veneers or any type of veneers that will show the beauty of it. Now, you know that veneers is becoming trending lately in the market, and it's so important lately for most people to look good, to feel confident about their smile. So the veneers is doing this, is like giving us a great alignment of the teeth, good shape, and also a good color, regardless the range of white that the patient will choose. So, by the way, if you have any questions about the veneers, please just ask us in our group. Joshua will explain a bit what is veneers, and you can share with us a few infos about it so we can help our patients.
Yeah, so basically when we are speaking about veneers, veneer is ceramic chip which we will place over your teeth, and yeah, as Dr. Rasha was mentioning, we have there different types of veneers what we can choose, or different shades, different colors, and yeah, we in the lab are producing them individually over each tooth where we want to place the veneer. We are getting then the impression which Dr. Rasha is taking then from each patient, and we in the lab are making sure that the veneer is then individually produced for this patient, and yeah, according then to all the needs and all the details what we are discussing before, what kind of shape, what kind of smile design, what kind of look the patient is looking for, and all these informations we are then in a team together discussing, and yeah, looking then that we are giving the best solution at the end.
So Joshua, let's speak a little bit about the procedure of veneers, because most patients, they don't know maybe how it goes.
Yeah.
So mainly it's composed from 2 to 3 sessions. The first, also there is like one session like consultation about what the patient needs. They will come asking us like what's exactly they feel they need in their smile, why they want to change it, what's the purpose of it. And it's like a consultation, a checkup, maybe some x-rays, and from there we can speak, if we agree about doing the veneers, we can speak a little bit about the procedure. The first session will be also preparing the teeth for those veneers. So as you said a while ago, it's a ceramic shell, right?
Exactly.
So it has like a thickness.
Exactly.
So this thickness is from?
So when we want to do an aesthetic veneer, we need minimum thickness of 0.3 to 0.5 millimeters to create really a good look.
Yes.
And this is this space what we need then to place.
So that the veneers will not look bulky.
Exactly.
So on the teeth, as dentists, we have to give the lab this space, otherwise the veneers will not fit on the teeth. And second thing, they will not compensate for this space. They will look so bulky if we don't give it a minimally preparation on the teeth. So we are giving the lab this space, but again, don't think that the dentist is gonna shave down your teeth or remove a huge layer from the teeth. We are sometimes going for non-prep or minimally prep procedure. So in this case, the doctor will have to polish, if I can say. This is how I like to say it. Just a little bit of polishing of the teeth in the areas where we feel that we need to remove from them. And then the doctor, of course, will take like impression or size of the teeth to transfer this smile to our lab.
Exactly.
And in this session, we can choose also the color with the patient, and if there is any preferable shape that they like about the veneers, we can also do it.
We could also, for example, do a wax up before, so that the patient is getting an idea about the shape.
Let's explain for them about the wax up, because I get asked a lot about what is the wax up and what's the use of it.
So, for example, in the first session, when the patient is not sure if the patient wants to go for the veneers or not. We can take some impressions, and we are receiving these impressions in the lab. And according to this impression, we are creating a smile design.
Yes.
And with this smile design, Dr. Rasha can transfer this without even prepping the teeth before to transfer it on the patient's smile. And then
Exactly.
immediately after 5 minutes, you will get the look, and you can see what is possible, what's doable. And according to this, we can still adjust then things, so we can
How the veneers might look like it's a close idea for the patient, like how might the veneer look like, so that they are not worried a lot about the final shape of the veneers. Exactly. So this is the first session of the veneers. We're done. We can place temporary also between the session, or sometimes not, it depends, but it's always regarding how much we are preparing from the teeth. And then after 5, I think, or 6 days.
Exactly, 5 to 6 days we need.
Yes, the lab will give us the veneers, and before cementing the veneers for the patient as final, we can try them first. And let the patient see we are fitting the units to make sure that they are correctly placed on the teeth. And then the patient can check the color and the shape. If there is any adjustment at this stage,
we can still do it.
We can still do it before the final cementation. So don't worry, we will not cement them behind your back.
This is true. No, we can still adjust it then.
Exactly.
Make some modifications.
Exactly, some modifications. I have one question for you, Joshua. It's about a patient asking about the Emax. Why it's called Emax? What's the advance of this veneers over other veneers? And is there anything called 3D or 6D veneer? This is something we need to clarify for the patient.
Okay. So when we are speaking about an Emax veneer, it's glass ceramic. I mean, we have there the opportunity to go for different kind of options. We in the lab, we mostly do it like this, that we are pressing an Emax veneer, and then we are making, we call it kind of a cutback. So we are reducing then the core of the veneer and then layering ceramic over this core to give
so layering help us to get what?
Layering means that we are building up the ceramic in different colors. So we don't have any plain
to make it look more natural.
To make it look more natural, exactly.
And close to the original anatomy of the teeth.
Yeah.
Because before the ceramic was what? I mean, when the older veneer, that's not Emax.
Yeah, this is, let's say, only one layer.
One layer, of course, yeah.
Of the, when you are pressing this core, this Emax, you have then one layer of the material, and it looks much nicer if you are reducing this, especially on the incisal edge. On the incisal area a bit, and you are layering them with different colors, a more natural look.
So Emax could mean also a plain surface, or it's mainly like layers?
It can be, yeah.
It can be,
yeah.
As long as it's having some aesthetic features in it.
Yeah.
So if the patient is asking for features in the veneers or anatomy, this is something we can do as additional, right?
This is something that we can do, exactly.
What we can do, but mainly when you say Emax, it means that it's highly aesthetic.
Yeah, it
regardless how it looks, if it's looking, if it's layering technique or it's having some features in it, right?
Yeah, that's true. I mean, this material we are using already a lot of years. It comes from Germany. Ivo Klar presented this many years back, and
you see, it's Ivo Klar. It's a German company.
Yeah, this is true. And it's a very nice product.
Yes. Do we have like something called 3D or 6D or 7D? I mean, if we're talking about dental terms.
Yeah.
Is there something called like this?
Not really, to be honest. I mean, in general, Emax veneer is an Emax veneer. It just depends then how the technician is finalizing it, and how much work he is investing.
But the word is Emax, right?
Yeah.
Not 3D, not 4D. Remember this. Just follow the word Emax veneers. And again, like Joshua said, Emax could mean a plain surface or a layering technique, but both of them will give you aesthetic look and aesthetic features of the veneers. Now, some patients will ask for extra features like a transparency, for example, translucency on incisal edge, or maybe some anatomy or structure on the surface, or layers like colors or stains, right?
So this is then what we are, what we can speak about. For example, when in this stage, when the patient is coming and deciding to go for the veneers, we can give some samples. We can show some cases what we did, so the patient is more understanding it and get an
Yes.
idea what kind of different options we
Totally.
can
You
give.
can always choose what you want for the veneers while communicating with the dentist or the ceramist, and they can also visit the lab, right? In case
course,
they want to
of course.
check something
Yeah.
directly. If you have any questions, please give us questions so we can answer them. I have also a question for you, Joshua, regarding sometime the difference in the prices of the veneers.
Yeah.
You just need to tell the patients exactly why there's sometimes difference in the process, if it's possible to clarify.
Yeah, of course. What we had already, I mean, this plain surface veneer and then the veneer where is more layering technique involved. This is then depends how many hours a technician is spending to produce these kind of veneers.
How many hours they can spend?
You can spend for this days. It always depends, let's say, how big the case is, how many units we are producing. If it's, let's say, 10 veneers in the upper jaw, the technician actually is spending
So they
2-3
can spend
days.
lots of time
Of course.
doing it, like 2 to 3 days.
Yeah.
So
I mean, you know, like technicians, they are kind of artists. Yeah, they want to play with this. They want to put all the
so
details.
patients think that the case of the veneers should be done in 1 day. That's not correct.
No,
Like
this is not possible.
that's not possible. Please, you need to also think about the lab, that they are spending some time working on these things, and in order for you to get a good result, you need to be patient with the lab and the dentist and give them some time to work on this case. If you want it to be really perfect, like don't rush the doctor or the lab, because they have also other cases and they need to take their time.
We definitely we are not taking the veneers out of the drawer and we are done then. So
Yeah, it's not like ready and we can fix them immediately.
There's a lot of handcraft involved. Yeah.
A lot. And you will not believe how much they spend time in the lab doing these veneers. I mean, for the dentist, the work mainly is in the clinic around like 2 hours each session, and that's it. But for the lab, they are spending lots of time working on these veneers. As Joshua said, especially if it's a layering thing, like it really needs lots of concentration and lots of work if you want it to be done perfectly. So
And at the end, also I mean, of course, we are speaking about the aesthetics and the look, but the most important thing is also that the veneers are fitting, yeah, that they are fitting like a glove on the tooth, so that we don't have any gaps or any short margins or things like this.
Yes, I agree. You need to be careful as patients how to choose the clinics who are doing the veneers, because the veneer is not only how it looks like. The veneer is something also related to the gum line. It's related to how it's looking more hygienic and more healthy on the teeth. It's not what it shows only, it's also the whole work. You need to check that it's fitting perfectly on your teeth. You can even take a mirror and ask to see the veneers, how it's on the gum line, and make sure that you don't see any gaps and you don't see any spaces, and don't accept that it's okay. No, you need to make sure as a patient also that when you check the relation of the veneers with the gum line, it should be fitting perfectly with no gaps. You shouldn't see something from the tooth. You should only mainly see the veneers there, and it should look perfect. Don't think that if one tooth is not looking similar to the other, that this is okay. It's not okay. They should be totally clean and perfect.
Question
And one,
2 weeks. Would 2 weeks be enough time to complete this process?
Yeah.
Yes, 2 weeks is definitely enough time, I would say. Yeah, we need in the lab always 5-6 days, and with the whole procedure starting.
yeah, more or less, like 2 weeks is definitely enough. Sometimes 1 week is enough if everything is working perfectly and the patient, for example, doesn't need wax up. They already know that they want to do the veneers. They already set their mind that they want to start with it. So we can take 2 sessions, only 1 week, especially if the second session, when we are fitting the veneers, everything is perfect and they feel that they are fitting in a good way. So we can go ahead with the cementation, no need to do any adjustment. I wanted also to speak about the quality of the veneers, that there's different quality in the lab, right? There is from Germany and there's from other brands or something.
Exactly. So
It doesn't mean that they're not good, by the way.
it also depends, let's say, what kind of material the lab is choosing. We spoke about the Evoclar product, for example, which called Emax. There are also different kind of products in the market, which are coming
Yes.
from different countries, let's say. So it always also depends where's the material from, what is
But
the
what's
technician.
the difference, Joshua, between like something coming from Germany and something?
It can be, for example, that the veneer is a bit more weak, or the material is a bit more
Yeah,
weak,
more fragile.
so
like
it
it might
can break easily. It also depends the technician. It can be that you are using one product twice, for example.
Yes.
Then this makes the material even a bit more weak. There are lots of things what the patient needs to be careful
It
with.
should be pure ceramic. You need to ask us some questions. I'm sure you have lots of questions about the veneer, so we are here to help you.
Yeah.
But it should be like Joshua said, it should be pure ceramic. Please, as a patient, like you have all the right to know what you have in your mouth. You have all the right to contact the lab. You have all the right to ask any question you want during the procedure. You need to know what's happening in your mouth. You need to know also what are these things that you are placing on your teeth. This is why it's important for you as a patient to communicate also with the lab and to know which lab is doing your case and to know exactly the thing about these veneers, how it's done, to check with the lab what you want, because the lab usually doesn't communicate directly with the patient, but in my opinion, it's your right to have to communicate with them in case you have anything you need to ask about or inquire about. It's your right to see the case done properly for you. And don't really negotiate with these things. These are important. You need to be educated also about the way that the veneers are placed in your mouth, because if you have a doubt that there's something wrong, then definitely like you should ask the doctor and you should check perfectly what's going on. Again, if you see any something not correct in the veneers when you check your gum or your veneers, you have to inform the doctor that you're not comfortable about it. What else,
That's
Joshua, would have to say? There is one thing I wanted to ask you about. Lately, we are hearing about zirconia veneers. Do you have any thoughts about it?
We have some doctors who are requesting this. This is true. I mean, zirconia veneers means then that you do a digital design and a milling machine is milling then the zirconia veneers, and with this base we are producing then the veneers. So it's a different technique and it's a bit different procedure, let's say, and of course a different material.
What's the difference between zirconia and Emax?
Emax is a glass ceramic, means this is what you can etch and bond, and you can give a better fit to the natural tooth then. At zirconia you can't etch.
Yeah, but is it like the same aesthetics, the same strength, or there is an advantage of one thing?
From the zirconia mostly, I mean there are also now materials with the similar strengths to the Emax, but basically the what makes the difference is the etching and bonding.
So the way we see them.
Exactly.
Okay, so it's a critical procedure, but mainly, honestly, I'm a big fan of Emax right now, and I feel that this material is highly aesthetic and it can do the job for any patients. Now, I know that most of the time the patients, they just worried about the idea of shaving down the teeth, because these, and the second one they are worried about is that the veneers will change their appearance and they don't know how it might look. So this is why we have two things to clarify about it. First of all, shaving down the teeth, it's not gonna happen in the veneers, because the concept of the veneers is that you're placing a very thin layer of ceramic on your tooth. So if you think about it, it's like the lens on the eye, so it doesn't need too much preparation on the teeth. Believe me, like sometimes we don't need even to shave down the teeth. And especially in the cases of lumineers, right? When the teeth, they don't need any preparation, the lab can do something called lumineers. The second thing is about when the patients are worried about how the veneers will look like. As Joshua mentioned before, there is something called wax-up. You have the ability to see the veneers, how they will look like before even doing them. So if you are comfortable with the wax-up, then you are definitely prepared for the veneer. So always ask your doctor to do for you a wax up, and it will help you a lot if you are not feeling ready for the veneers.
And it's also a super nice technique, yeah. I mean, it's not painful at all.
Yes.
You are just placing it for 5 minutes, and you can see then after these 5 minutes already where you can be.
Yeah, and you can remove them directly
Easily.
on the teeth
Yeah.
immediately without any
You
thing
can
that will damage.
Take some pictures. You can show them even to your family.
They can even stay, I think, 2 days or 3 days with it.
I mean, we have this sometimes that
Yes.
patients are going back home, then showing it
They want to
to
enjoy
the
it.
family, to the friends, and then after this they're coming back to the clinic, and you can remove it.
Yes,
immediately.
it is easily removed from the teeth. Takes literally 5 minutes, and your original teeth will be back to their state. Nothing will affect them. And sometimes we use the wax up also as temporary between the sessions.
Yeah.
So you will have an aesthetic look also between the session. You will not appear weird or something.
And for us, it's very important to do this step because when you like the wax up and you like the design, we can copy this in the lab, and we can produce the veneers exactly according to the wax up.
Yes.
Or let's
You can use
say
the wax up as the final shape of the veneers in case you like it.
exactly. Or even after a couple of days, you say, I might find that the wax up looks a bit too bulky or a bit too long or something. You can give these informations then to us, and we can adjust it then to the final.
Yes. So, so Joshua, regarding Emax veneers, why is it like so preferable recently more than the composite veneers or the whitening? I think it's good for the patients to know
Yeah.
why they would be encouraged to do the veneers,
I mean,
right?
like Emax veneers, it's a pure ceramic, and that's why the surface is totally different to a composite veneer.
So they last longer.
They last longer.
Yes.
They are not changing their colors after a while. If you're
No
drinking,
discoloration, no stains on them.
exactly. If you're drinking coffee, tea, and these kind of things with this composite veneers, you have sometimes after a while different colors or
Yeah, or some
color
stains.
change or something. All these things you don't have with Emax veneers. Yeah, that's why they are way more aesthetic
And durable.
Yeah.
But there's different again. There's different shades of white. I mean, recently most of the patients are asking me, we don't want the super white, the
Yeah.
super bleach.
Yeah.
So also this is something for the patients to know how many shades we have. Right?
We can go from super white to super dark. Yeah, I mean there are all kind of different colors.
No, I go for super dark. Yeah.
We have
It's different shades, like, but
Exactly.
starting.
like the brightest one is a BL1
Yeah.
bleach color. So we have 4 different types of bleach colors. This BL1, BL2, 3, and 4. And then let's say after these bleach colors are the let's say more natural colors coming. This is then B1, which is then they're the brightest. And then we have A1, A2, A3.
And you can always check in the clinic with a shade guide with a dentist which color suits you. Like you can take the shade and try it and check on the mirror.
Exactly.
If everything is perfect for you and you see that this color is convenient.
And with this wax up, for example, you can use also different materials. You can use a bleach material to try it, or you can use maybe a B1 to have it a bit more natural. Always depends what the patient prefers.
Yes, exactly. And that's it. So do you want to add anything, Joshua, about the veneers? Do you have any advice for our patients?
I mean, what I would say is definitely when someone is interested in doing veneers, you should come to the clinic. You can see some cases here also. You can see how the procedure is done. You can visit us in the lab if you want. You can see how the technician is working on these kind of veneers. And definitely point to be convinced is this type of wax up, and to see how can I change my smile in adding some volume of my teeth, and there's definitely a wax up the best solution to see what kind of result I can get without even touching and drilling and not changing anything. Yeah.
Yes, and remember, if the veneers are done correctly and perfectly, and if the fitting between of the veneers, should be done well by the lab, the veneers, they don't have like really any like side effects. Like I get lots of questions regarding any smell or cavities under the veneers or any issue with the gum. But if it's done perfectly and the veneers are fitting well and it's done with from a good quality, you will not have any issue with it. You just need to keep brushing and flossing normally as you do. And if you have any question, you can just ask the dentist if you have any more details or inquiries you want to ask about. So we're done for our live today. If you have any topic you want us to talk about, please just feel free also to DM us on the clinic and we can go live for any other subject if you're interested. Thank you, Joshua.
Okay, thank you. Have a good day. Bye-bye.
Thank you so much for doing this.
Yeah.
I really enjoyed the session.
That's
Did
good.
you enjoy Paul?
Yeah, I did.
Did you
Yeah.
listen to us?
So you know now how to do veneers and this kind of
Yeah.